Hey guys, welcome back to my channel and welcome to 2021. My name's Kris, I'm a newly fellowed GP in Australia, and today I've got a couple of tips and tricks for the new interns about to start their first year as a junior doctor. Now, a couple of disclaimers, which I feel like I always start with. I did my internship in Queensland in Australia in 2017. So whilst it wasn't that long ago, a lot of things could have and may have changed. And I also did my internship in a small semi-rural hospital here in Queensland, across actually 3 different hospitals in the same region. So a lot of the things that I talk about may not be relevant to you. For example, we didn't have any subspecialties. We just had general medicine, general surgery, general orthopedics, general pediatrics, and so on. So just keep that in mind. If you hear I say something and you're like, oh, that doesn't quite work for me, take what you can out of everything and we'll just keep going. So, congratulations on graduating from medical school. It is one of the best and worst feelings in the world. Best feeling because you've just completed anywhere from 4 to 7 years of study, hard work and dedication, and it's all brought you to this point. Terrifying because holy moly, you are now doctors. And it's a fantastic title to hold, but it comes with a lot of responsibility and can come with a lot of fear. Now, for most of you, you would have done some sort of placement in the hospital system you're about to work in, whether it be South Australia Health, Queensland Health, New South Wales Health, or whatnot. But for some of you, you've moved towns, you've moved states, some of you may have even moved internationally. I had a couple of American, New Zealand, and 1 British doctor come over to Australia for their internship. So remember, you are not alone and there is someone out there just as scared as you. That being said, I wanted to give you a couple of general tips and tricks that I wish I knew as an intern. Tip number 1, know your worth. It's a pretty heavy one to start off with, but most people click off my videos pretty early, so I figured this is the one to tell you now. You have made it. You are worth it. You know what you're doing, and if you don't, that's actually a good thing. There is something called the Dunning-Kruger curve, where a little knowledge is bad and too much knowledge is bad, and you want to be in the middle. I'll insert it obviously on screen so you can see what I'm talking about. But just know that you are supposed to be there. You have done the hard work. You do deserve it. That being said, you also have to realize your worth in that you are not supposed to be working for free. You are not supposed to be working outside of your scope. As an intern, you are always supposed to be supervised. And that doesn't mean your supervisor has to be in the room 24/7 with you. God forbid, that would be annoying. But it does mean that in the end, all the decisions you make do not have to be on your shoulders alone, and they shouldn't be. I'm fairly sure it's illegal. So just know that you are an absolute asset to the team. You have worth. I don't know how many times I can say worth in this video, but you know what I'm trying to say. Just know that your seniors do not expect you to be sitting around for 6 hours after your shift doing discharge summaries or rounds or anything like that. You are allowed to go home on time. You are allowed to save jobs for the next day. Of course, it comes down to triage, what's important needs to be done today and whatnot. But just know that you are not just a grunt. So tip number 2 from me is keep snacks on you at all times. So I mentioned your worth and that you are valid and you should be having breaks and you should not be staying back too late. But sometimes it hits the fan in the hospitals very, very frequently and very, very fast. So you may not have a whole hour to eat sometimes. I hope you do, but sometimes you won't. So what I recommend is keeping snacks on you at all times. Muesli bars, protein bars, whatever. I mean, I've just mentioned bars, but whatever you would like to snack on, keep it with you. I used to carry what was called the nerd box, or it was this clipboard carry case with me, and in it I would always keep highlighters, spare pens, and snacks. Trust me, the snacks were the most important thing in that carry case. So that's a tip that some people didn't do. And it's like I didn't do it first, and I'm so glad I learned it later on. Tip number 3 is to have a good handover. So most of us are taught ISBAR or ISOBAR, introduction, situation, background, assessment, recommendation. But putting that into practice is hard. And you will come to realize almost pretty quickly actually that a bad handover can just make everything worse. So what do I mean by handover? So say you are an intern, because you are, and you were trying to get advice from another subspecialty, or you were trying to hand over to someone, or you were trying to refer to someone. How you say it and what you say makes a big difference on how it's received and the outcome and the timeliness of that outcome. So for example, say I'm an intern in the emergency department wanting to admit a woman to obstetrics. When I call up the registrar, they want to know a couple of key things straight away. Now, you are not expected to know what all these key things are, but there is a general gist. So number 1, who are you? So when they pick up the phone, you need to confirm that you're talking to the right person. So, hi, is that the registrar for OBGYN? Cool. My name is Dr. Kris and I'm an intern in the emergency department. Second step, which will flow on immediately, is this a good time for a chat? The reason I say that is you may find that you'll call someone and they will be in the middle of something critical and they'll answer your phone because they have to, but it may be that 5 minutes time might be better because they might have finished putting in that drain or having that handover or whatever. So always ask if it's a good time. So hi, is that the registrar for OBGYN? My name's Kris, I'm one of the interns in the emergency department. Is now a good time for a referral? Done. If they say, yep, shoot, then it's your time to shine. So that was introduction, now it's situation. I have a 34-year-old pregnant woman with bleeding, or I have a 16-year-old girl with abdominal pain, or I have a 19-year-old with a suspected ectopic pregnancy. Basically, we need age, gender, and what you think is going on. So that really makes the person on the phone listen and switch on. So that's ISB. Now A is assessment. And so this is what you've done. So you should work up your patients, and a good workup is a history, examination, and preliminary investigations if they're accessible to you. So let's go back to the suspected ectopic pregnancy, right? So I forget how old I said she was. Anyway, 19-year-old female with a suspected ectopic pregnancy. She presented this morning with 4 hours of 10 out of 10 left iliac fossa pain associated with PV bleeding. A urine pregnancy test has come up positive, and preliminarily our ultrasound does show that it appears to be an ectopic pregnancy on the left fallopian tube. I'm hoping to refer for an immediate surgery, laparoscopy, whatever. Done. They may ask you for a little bit more, I guess ectopic is a bad example because there's a lot else there. But you kind of see where I'm going with that, right? I think it's this, our preliminary investigations say this, I want you to do this. Don't hand over and say, yep, we've got it, because the person on the phone's going, and what do you want me to do? Do you want me to tell you, yes, you're right? Do you want me to take over management? Do you want me to, send it to theatre? So yeah, another example, again, emergency is a good one because you do a lot of handover. Hi, is that the paediatrician on call? My name's Kris, I'm an intern in the ED. Is now a good time for some advice? So I've got this 6-year-old boy who's had nausea and vomiting for 3 days, who's presented rather dehydrated and tachycardic, and I'm wondering about fluids. So this 6-year-old boy has no previous medical history, and as I said, he's had 3 days of vomiting and diarrhea. He's presented today with sunken eyes, dry mouth, blah, 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 blah. Mum and Dad say that he hasn't been exposed to X, Y, and Z. No one else in the family is sick. He does have a rather tender abdomen, but I don't have access to an ultrasound. I've started doing fluids, IV, whatever. I was wondering, do you think it's necessary for us to do this? Then they'll give you your answer, they may provide some more advice. Phone call done. So have a good phone handover. If you have face-to-face handover, it's all the same stuff, you just don't have the phone. Tip number 4, legitimately don't be afraid to ask questions. In a ward round, in a handover, in the middle of the day, don't be afraid to ask questions. we know, and when I say we, I mean more senior doctors know, that you're new. You are going to have a bajillion questions, and we were all like you once. Don't be afraid to ask. Time it, of course. If someone's giving bad news, don't ask an inappropriate question at that time, but ask questions. More senior doctors than you would much prefer that you ask questions than make mistakes and then say, I wanted to ask, but I was too afraid, you were too busy, I was too scared, whatever. Honestly, medicine is a team sport, so don't be afraid to ask. Even if you think it's silly, even if you think you should know. And that brings me on to tip 5, you are not expected to know everything. Yes, you've just passed your final medical school exams within the last year. Yes, you are fresh. Yes, you will know a lot, but we don't expect you to know everything. It's okay to forget things. It's okay to relearn things. You'll learn something from a textbook that'll be so different to real life. You'll learn guidelines, and then you'll find out that situationally you can't follow those guidelines because of X, Y, Z reasons. So you will learn on the job. You are not expected to know everything. Tip number 6, learn the back routes. So basically, you will know the routes where you can walk into the hospital like a patient would, or a relative, or a visitor. But there are routes in the hospital that get you from point A to point B a lot quicker, and there will be different stairwells that you can only access when you're a staff member, different elevators you can only access as a staff member. Learn these. Whether it be you follow someone around, a resident or a registrar, whether it be during your lunch break you go for an explore, although I really strongly recommend that you relax during your lunch breaks if you get them. But learn the back routes. It really will make your life so much easier. Tip number 7, be kind. Be kind to yourself, be kind to your patients, and be kind to your team. Your team, mind you, is not just you, your resident, your registrar, and your consultant, but also your nursing staff, your admin officers, your liaison officers, your social workers, your physios, everyone. Be kind. We're all in this together. Ultimately, we all want patients out of the hospital better than when they came in. Ultimately, that's what we want. In reality, it's not that simple sometimes, and it doesn't happen quickly. So be kind. Be kind when you deny or accept requests. Be kind when you answer the phone. Everyone gets tired, everyone gets grumpy, but be kind. You will probably experience, and I'm so sorry in advance, people being grumpy to you for asking questions, even though I just said that we all want you to. You may experience people being grumpy or angry with you if you are late, or as in you can't find your way around, or you don't know how to order something or whatnot. Be kind to yourself in those situations and try to have a bit of empathy. Think, why are they feeling like that? Obviously it's more on them than it is on me, and learn from it, continue. It is very easy to burn out in internship, so please do look after yourselves, and that's where it comes down to, is be kind. Be kind, be kind, be kind. Tip number 8 is a little bonus tip that I didn't originally script for this video, but do your discharge summaries on time, please. So as a GP, I now realise the absolute worth of a good discharge summary. As an intern, I used to churn them out so quickly, or not at all sometimes. But the thing is, patients will go back to their GP and say that they were in hospital for 6 days and they had an operation but not know what it is, and then the GP won't know what follow-up to have. If you ever put GP to chase results, please CC the GP into said results, because we don't access your system very easily, if at all. Put in the pertinent stuff. As a GP, I don't actually care if they had 4 or 6 litres of normal saline over the week, but I do care that they had IV rehydration. I don't care how many different medications you tried in what day, but I do care what you've tried, what did and didn't work. So instead of saying, day 1 tried amlodipine, day 2 tried ramipril, day 3 just say, over course we tried X, Y, and Z, ended up with this is the plan for titration. I am probably going to do a whole video on discharge summaries, so stay tuned. But that's it, guys. That's all I've really got with 7+1 tips for an internship. I hope you're doing well, and I hope that you enjoy your internship. I loved mine. If you want any sort of reflections on what my internship was like, I do have a whole playlist of the rotation diaries, which is basically me reflecting on all of my rotations as a junior doctor, including reading from my diary. hence the name. But until next time, guys, stay safe, stay healthy, look after yourselves, be kind to each other and to yourselves, and I'll see you in the next video.